Good afternoon. I'm Mayor Tom Barrington. I am joined by Commissioner Baker and Dr. Swine from the Health Department. As we indicated on Friday, what we wanted to do today is to give you an update as to where we are in terms of cases, and more specifically, give you more information pertaining to school closures and what parents, staff, and students can expect during the coming week and weeks. Let me begin by saying that today we are reporting an additional 18 probable cases. This brings our number to 54. That is a 50% increase over the number we reported to you yesterday. Again, that is 54 probable cases. That means cases that have both been confirmed and ones where we believe, based on our testing here, that those will be proven to be flu cases. Commissioner Baker will go through the school closings, the additional school closings. We are not closing the entire district. I want to start right there. When we talked Friday, I said that that was not inconceivable. What we have chosen to do was to continue the path that we began last week, where we look at individual schools and look at the individuals, the children in particular, who have been tested for having the flu, if they attend those schools. And so that will continue, or has continued to be, the criteria that we have utilized. I also want to point out that Friday morning at 6:35 a.m. approximately, the Center for Disease Control changed its guidance or its recommendations as to the length of school closing. And these are recommendations. We are not bound by these, but because it is the Center of Disease Control, we take their guidance very, very seriously, as we do the guidance from the State of Wisconsin Health Department. Both the Center for Disease Control and the State of Wisconsin now recommend that schools be closed for 14 days. We are not standing before you today announcing that these schools are going to be closed for 14 days for several reasons. First, in our conversations with the Centers for Disease Control yesterday afternoon, and Dr. Swine, Commissioner Baker, and I were on a conference call yesterday with both the State Department of Health as well as the Centers for Disease Control, and they indicated to us that they are continuing to look at their guidance as well. We don't know exactly what that means, but what we want to do is to give some guidance to parents and to staff so that they have an understanding of what they can probably expect this week. And Commissioner Baker will go more into depth about that. I understand both as mayor and as a parent that what we are doing causes hardships for students and for parents and for staff, and that is certainly not our intent. What we are trying to do is we are trying to deal with a situation that is unprecedented in this community and unprecedented in this country. We are dealing with a new virus, and a virus that does not have vaccination at this time. We are following the lead of the Centers for Disease Control because that is the agency which is grounded in science. And it is my hope that as the week progresses, that we will see that the severity of this continues to be low. And it is my hope that we will also see, as a result of that decrease in severity, that we will be able to back off some of these recommendations. But we just wanted to give you a starting point as to where we are right now. And I will now turn it over to Commissioner Baker to go more in depth as to the schools and more information. Commissioner?
Thank you, Mayor Baird. On the onset, again, I want to reiterate what Mayor Baird had said, that this is a new virus and no one here, no one anywhere else has immunity to it, and there's currently no vaccine. So all the actions that we've taken to contain this outbreak here and at the national level in this very short time are anchored in the fact that none of us have immunity. Again, we've seen an 18 case jump, and while we will continually see our case count go up, our mitigation on the ground includes school closures. After our conversations with the CDC and the state of Wisconsin, we felt that it was a decision not to close the entire district. I reiterate that. But we also feel that to protect the public's health, the following schools, which are 4 additional Milwaukee public schools and 5 non-Milwaukee public schools, need to be closed, and that brings our actual overall closure to 21 schools. In addition, we have closed 1 child care facility. The new schools closed are as follows. Christ St. Peter Lutheran School at 2229 West Greenfield Avenue. Christ St. Peter Lutheran School at 1204 South 8th Street. Curtin Leadership Academy at 3450 South 32nd Street. El Fuente High School at 611 West National Avenue. Our Lady Queen of Peace at 2733 West Euclid Avenue. St. Anthony's School at 1747 South 9th Street. Alcott Elementary at 3563 South 97th Street. Guadalupe Head Start South, which is at 239 West Washington Street. And Hayes Bilingual School at 2431 South 10th Street. The child care facility that we've closed is Heavenly Angels Child Care Center, which is located at 2455 West North Avenue. Now, the CDC recommends that these schools and this child care facility remain closed for up to 14 days prior to reopening. However, the City of Milwaukee Health Department will monitor this situation daily, and in 6 days, we will reevaluate the possibility of opening schools sooner than the CDC recommended 14-day period. We will provide a copy of the complete list of schools and child care closures, and we will continually refer citizens to our website and our hotline, which is 286-3616. During the time that the school is closed, the health department is urging that the staff and children remain home during the closure period and not recongregate in community settings. Remember, children and staff are likely to have been exposed to this novel virus, and there may be an incubating period for this disease that we have to monitor. It's important for them to stay at home to minimize and curb the spread of disease. And we, again, strongly urge all individuals within our community who are exhibiting symptoms of respiratory illness to stay at home, to not to go to work at school, to curb the spread of this disease. I reiterate the good hygiene that we talked about all week long. It's important that we practice that. And I also reiterate the notion that tens of thousands of individuals die from regular influenza each year where we have vaccines available. We don't have vaccines here. This is a novel strand of influenza. And I want to reiterate that this is rapidly changing globally. We've had extensive conversations with the CDC and the state. Our information is up to the moment, and this is a global concern. None of us knows exactly how this story ends, but we do know that with prevention, we can get out in front of this story. So as the guidance becomes available from the Centers of Disease Control, we will endeavor to be rapid in our response, and we will change our advisories on the ground. But at this time, the health department takes these actions to be prudent and to protect and safeguard the public's health. And I'll turn things back over to Mayor Baird.
If there are any questions, we'd be happy to take any questions.
How do you determine which schools are closed? Are these all cases where students have had contact with someone who is probable swine flu case?
The first 4 schools that we closed, those were schools where we had individual students who were related to one of the 2 that are confirmed, and that those students had also showed symptoms of the flu. So it was both blood relation and symptomatic decisions. Subsequent to that, these schools are all schools where actual students attending those schools have been shown to be probable.